Miss Brandy. I'm Camille. I'm your nurse. How are you doing? Awesome. Can I just check your wristband? Can you state your name and date of birth for me?
Brandy Costello, 7/2088.
Awesome. Thank you so much. And how are you feeling today?
I'm good.
Good. So I'm here to just go over like a teaching plan with you that I started yesterday because I noticed in your chart how you said that you've been out of your medication Synthroid for a while now. Can you tell me how long it's been since you've taken it?
It's been a few weeks.
A few weeks? Okay. So I just kind of want to go over like why it's important to take your medicine every day, what it's for, and stuff like that. So the first question I want to ask you is, do you know what hypothyroidism is? Your diagnosis?
I do.
Yeah, okay. Well, I'm just going to reiterate what it is.
Okay.
So basically your thyroid gland's in your neck, and it kind of is like our system that controls our metabolism, so like how we like burn fat, lose weight, stuff like that, okay? So when it's not working, so when it's like hypothyroidism, we just don't have a lot of thyroid function, okay? So basically it just doesn't produce as much enzymes that we need to make it, run good. So when you have hypo, you have to take what's called Synthroid or levothyroxine, which is the generic name, just a long name, to help regulate it, okay? So first I'm just going to show you kind of how to take your medicine, just to make sure you know how to take it every day. So do me a favor and just read out loud what your pill bottle says, like the name and how many, how big the dose is.
Okay, it's levothyroxine, and it's 112 mcg tablet, and
And you can tell me when you take it.
one tablet in my mouth before breakfast.
Okay, good. So before breakfast is important because you want to try to take it before you start eating for the day. And then a big thing is this medication, you want to take it with a full 8-ounce glass of water. This isn't exactly 8 ounces, but you can just measure it, or just a typical glass in your kitchen, 8 ounces. You want to take the whole thing just for airway compromise, okay? Just doesn't get stuck in your throat. And you want to take it when you wake up. My mom always told me just to watch an episode of SpongeBob while I wait to eat if I'm like super hungry. Just let the time pass. So show me how to take your med just so that I know you understood.
So when I wake up before breakfast, I'm gonna take one tablet and drink 8 ounces of water.
Awesome. And how long should you wait before you eat?
About 30 minutes.
Good. Okay, awesome. Do you have any questions about that?
No.
Okay. So my second topic I wanted to talk to you about is, can you tell me a little bit about why you stopped taking your medication?
It was hard for me to get to the pharmacy to pick it up, and I felt like I didn't really need it.
Okay, good. Well, I do want to tell you that it's very important to take this medication due to your pre-existing diabetes mellitus. Not taking or not following your medication regimen will also has the chance to disrupt your other conditions, so it could make your diabetes worse. So you do need it every day. This medication is a lifelong therapy, so the day you get diagnosed, you will have to take the medication for the rest of your life, which sucks, I know, but I take it too, and it is what it is. And so, yeah, and I mean, if you have like family members, or anybody that lives with you, or friends that you see a lot, I would be willing to talk to them and just make sure to remind you, maybe if you forget one day, to take your medication, okay? So do you have anybody that you can think of that, can kind of help you remind you just to take it?
Yeah.
Okay, perfect. Do you have any questions?
I know.
Okay. So the last one I want to talk about is I want to tell you like what are the normal signs and symptoms of taking this medication, and then what are like the abnormal ones where you need to call either your doctor or like medical emergency, okay? So I have this handout that I printed out for you. It also has the signs and symptoms. It has, how to take your medication, drug interactions that I think are important. If you do take any of these, you're going to want to talk to your doctor. And then it talks about if you have other medical problems like diabetes, talk to your doctor, but I think your doctor does know that you have diabetes because we've been doing active checks on you. And it just tells you if you miss the dose, what do you do, how to keep it in storage, precautions to have, and then the signs and symptoms are at the back. So normal signs and symptoms that usually occur as you start your medication and then gradually decrease after a few weeks. They're normally like increased appetite, weight loss, heat sensitivity, excessive sweating. So, normally when you're not taking medication, hypothyroid patients get more cold and they're sensitive to cold, but once you take your medication, you start to get, it just kind of hits you when you get hot. So that just might be, if you go outside and get too hot, go back inside, relax, drink some water. Headache, hyperactivity, so you're going to have a lot more energy because those hormones are working normal again. Irritability and tiredness. So those are normal for the beginning of the therapy, but if they do last for, months and they start to get severe, talk to your doctor, call your doctor about it, okay? And some abnormal ones, these are the ones where I want you either call your doctor or if you're in a medical emergency, call 911, okay? So this is gonna be like chest pain, shortness of breath, discomfort in like your chest little area, upper body, like shoulder. It could be something too, extreme tiredness, like you can't even keep your eyes open, feel like you're gonna pass out, swelling in your legs, ankles, or feet. Unexpected weight gain, like you're not doing anything in your diet where you just gain a bunch of weight really quick. Very fast heart rate, palpitations, you feel like your heart's coming out of your chest. Irregular heart rhythm, very bad stomach pain or wheezing. Can't breathe, okay? So if you get any of these symptoms, call your doctor or call 911. And I got these all for you so you can look at it and it'll tell you what to do. If you have, like non-emergency, those are normal, or if they're going on for a few months or they're very severe, call your doctor or call 911. But I have everything and this is for you.
Thank you.
Do you have any questions over anything we went over?
I do not. Thanks.
Okay, awesome. Well, I'm going to come check on you in a little bit, but I'm going to go document what we talked about, and you just press your call button if you need anything, and I'm going to lower the bed and lock it. Just let us know if you need anything. Okay, I'm going to wash my hands.